Hello and welcome to Marseille. We're EBMT TV and we're back again.
This is a very committed community of professionals bringing together many categories, physicians, pharmacists, nurses, psychologists, psychiatrists.
Beautiful sunny day in Marseille.
Yes, we organize everything in the details.
The transplant field is evolving.
Right.
Everything is moving, and one of the most important aspects is the introduction of all novel drugs, targeted therapies, immunotherapy.
Nurse education is vital. It is their absolute backbone, I believe, to the care that patients receive.
The key for the EBMT role for us is when we have new things, we share it with each other.
You have to be involved because there are so many projects, and it's something that one time you start, you never stop.
Transplantation is the first form of cell therapy, but now we know which cells we could add, manipulate and use, and it's working. That's why it's a standing point. That means that we'll have new weapons to make the therapies more effective and possibly more personalized and less toxic.
Doses is really a main issue for patients for all the drugs that are used in bone marrow transplant, and I think this is a true incentive to have this Pharmacist Day.
It's very difficult to be closed in a room for maybe 1 month or 2 months.
C'est de leur proposer donc des temps de parole, mais aussi de les aider par d'autres méthodes qui sont les soins complémentaires, qui sont par exemple l'hypnose, la sophrologie, l'ostéopathie.
The EBMT has produced a short video to help to inform the patients about what the data will be used for and the importance for them or for us and for future patients that we can get data.
There is also an increasing evidence from the data of the EBMT, also from the literature, that accreditation program increase the safety and the efficacy of the clinical outcome.
Don't worry, you can do it.
If I have a clinical problem, a patient I'm not sure what to do with, then I can email around that network and ask colleagues all around Europe and indeed all around the world, how do I approach treating this patient? And I will get sometimes many answers and many suggestions.
The best thing about this ambassador program is connecting with physicians involved in the field and people I would have probably never met.
Moi, j'ai été une patiente greffée en 2010. Donc, mon rôle, moi, dans le BMT est simplement de témoigner et de montrer que on peut passer par la greffe et finalement arriver à reprendre une vie normale.
It's very important that physicians and patients are working together as a team to face this situation, and what is also very, very important is that patients who have been already treated then are going to speak with the new patients to say, look, I got the same thing than you 2 or 3 years ago and I did a treatment and now I'm feeling perfectly well.
Now, because I've lived the transplant, I can't talk with difficulty in English, but I can talk about this experience. It's only my experience, but I can share.
We were sort of an egalitarian team. There was no hierarchy. Yes, Don Thomas was a professor, and we were sort of, Bob Epstein and I were in the laboratory, and we just went about it in a very systematic fashion. But the reason I think we were successful is that we were bench researchers who then translated and then back to the laboratory.
EBMT is actually a global organization. The global committee will reinforce the global function of EBMT.
A lot of our patients are on social media now, Twitter, Facebook, a variety of platforms. And it's a great way to interact with them, to engage with them, give information and also learn from them.
Lisbon is a fascinating city to go to. I mean, you have plenty of sunshine even during the winter. You have very rich local gastronomy. Portuguese wines are getting...
Oh, fantastic. Yeah. So until next year in the beautiful Portuguese capital of Lisbon, it's goodbye.